Welcome to today's webinar presented by supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Slide 5 is just kind of a cross-section showing you, again, where you're at for those different compartments, and again, also what's the anatomic areas in that, those tendons in that area. Intercarpal joints is an important thing to know. We do a lot of intercarpal injections. Those would be the small injection fusions, arthrodesis, and then there is the code in which they talk about carpectomies, and they talk about all the bones of the proximal row, or they talk about carpectomies individually. And it's important to know that the proximal row, you got a proximal row and a distal row. There is a little added bone that's the pisiform, that's kind of a little floating one. On slide number 6, it kind of shows you that picture there, and it tells you that even if you don't excise that pisiform bone, it's still considered the proximal row. If you do the scaphoid, the lunate, and the triquetral bones, you're looking at that would be the reporting of the 2, 5, 2, 15, not the individual bone. On slide 7, both CPT and ASH, the American Society Specialty for Hands, they let you know that, again, not having that little pisiform still does not take away from reporting 25215. There's on slide number 8, the January 2005 CPT assistant tells you that those would be the ones in which you'd be able to support the proximal row and then also give you information regarding the distal row. We have ganglions on slide number 9, and we have 2 codes for ganglions of the wrist, 25111 and 25112. The difference, of course, is if they are recurrent. And so the provider really needs to tell us that they are recurrent ganglion or that they've been excised before and they've come back. If they don't state that, we'll have to use the 25111. You can't use the recurrent unless the documentation supports that. You'll know notice that your ICD-9 codes talk about it being in the joint. Again, make sure your documentation states that the ganglion was in the joint. If it doesn't state it's in the joint, you're going to use one of the other 727.4 codes. On slide number 10, there's a code in there that we have that's the code 26591, and it talks about the repair of the adductors, the AD pollicis muscles of the hand. And if you don't know your anatomy, you may end up never using this code because they may not say that they did a repair of the abductor or what they call about the intrinsic muscles of the hand. And so they may just say instead that they're doing the repair of the adductor pollicis. I haven't seen very many operative notes where the doctor actually said that they repaired the intrinsic muscles of the hand. And it says for each, you need to know what those intrinsic muscles are. So if they talk about doing repair of the hypothenar, or they talk about the flexor pollicis brevis, those are things that would fall under that. Many times we've been using unlisted codes because we couldn't find a repair of a muscle in the hand area. And so understanding what group of muscles 26591 can represent, we may now be able to do better coding. On slide number 11, we've had a lot of changes in some of our fracture situations on how we can report. Years ago, when we billed out and we did both a distal radius and a distal ulnar, we found out that they were combined. We couldn't bill them separately. We also had years ago in which we couldn't bill out for the external fixator. If we did both internal and external, we never got to bill for the external. They removed that now, and several years ago, you are able to bill now for if they put in internal fixation and they also put on an external fixation, we can bill those two separately. It's important that your provider tells you was it a uniplane or a multiplane. I'm finding that a lot of the surgeons do not support that in their documentation. They only just say an external fixator was placed. The majority of those are going to default to the 20690 unless the provider clearly states in the narrative that it was a multiplane.
SuperCoder is the fastest-growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.